Welcome to Mental Health Monday. My name is Mick Coyle. Coming up on the programme this week,
it was quite honestly terrifying. Now, as someone prone to anxiety, there was kind of a personal element to that, but also I couldn't do everything that I wanted to do because of lack of time, lack of resources, lack of people. Doctors are expected to be magic and healthcare workers magic and resilient and amazing. And yes, what an amazing role it is to be a healthcare worker. You know, it is a huge privilege looking after people. But quite often this is to the detriment of healthcare workers' own health and well-being. It's where we enter the world of burnout, where you're stressed for such a long period of time without the adequate resources to recuperate, and you go into this state of burnout where a couple of weeks holiday isn't going to help, because actually this becomes a big mental illness where you are really struggling to cope with the workload and just day-to-day life, and it's a combination of many different factors.
The home of the UK's conversation about mental health. Welcome back to the programme. Welcome back to the podcast, Mental Health Monday, as we head towards Christmas 2024. What we'll do then over the next couple of weeks is we will get you a podcast this week and a podcast next week. Then we'll take a break over the festive period, but we'll make sure that next week's podcast has got a Christmas and New Year sort of vibe to it. It's not going to have tinsel or anything like that, but it's going to be talking about this time of year. If you're listening to this at the time of the podcast goes out, it'll still make sense as a regular conversation if you're picking this up at a later date. What we'll do then is we'll pick up the podcast in the new year. I've got a really interesting conversation on the way about mindfulness in schools, which is a really big issue. We'll have that conversation the first week back in January. So my name's Mick. Thanks for checking out the podcast and your downloads, your streams, and supporting what we're doing on social media with Mental Health Monday. Another conversation on the way today. You often hear that winter is a very busy time for the NHS. What with things like flu and COVID and the after effects of various things that really put pressure on certain departments at this time of year, and with that pressure on staff, who basically never really get time off anyway from the pressure of dealing with, the healthcare crisis and the issues around the NHS that we all know exist at the moment. Now, there is a new campaign underway from Doctors in Distress, and they're looking to raise money for their Every Day of Every Minute campaign. Now, what that is about, it's about making sure that there are services available to doctors and staff within healthcare environments to contact them, to reach out if they're really struggling with their mental health. It's a really obviously important thing to do, and for people who obviously have a very important role to play at the same time. Now, I will put links to the Doctors in Distress appeal in the podcast notes, and our guest today, a former doctor, now turned wellness coach, will talk through what those pressures look like and feel like, and how people cope or don't cope during this difficult time of year. It's a really important thing. And actually, there's a lot of stats out there which show just how important this is. The suicide rate of nurses, approximately 1 a week. The suicide rate of doctors, approximately 1 every 3 weeks. The link to the Doctors in Distress appeal will be in the podcast notes, and Emily Fulleylove is our guest. Now, she quit her job as a doctor within the NHS for reasons that she will explain in the podcast. But I put it to her at the start that, it's an important time of year, and maybe, just maybe, there's an expectation from members of the public that somehow doctors and nurses have got some sort of like wellness force field around them because of the type of work that they do.
Yeah, thank you so much for having me on today, Mick. You're absolutely right. In fact, when I applied to become a medical student, no one in my family had been a doctor before, and I assumed that there would be some kind of magic that would make me into a doctor, make me this superhero of a person who needed very little from anyone else and knew all the answers and could cure everyone. And I quickly found out that that's not the case when you train to be a doctor. So doctors are incredibly well skilled and equipped with so much knowledge. And I quickly found out as a medical student and a doctor that a lot of the resilience and well-being of medics isn't just a given. It's something that you build up over time. But I was also very surprised that there wasn't an automatic provision of mental health support as a medic. And in fact, so I trained as a doctor and worked in 2008 and 2009. And I left my medical career because I essentially thought it was just me. I thought, okay, I've made a mistake. I'm not strong enough. I'm I had anxiety and depression at medical school, and I just thought I'm not made for this. And over the last few years, it's become apparent that actually, it wasn't just me, and this is a problem that is increasing in the NHS, where there is a lot of um, doctors and all other healthcare professionals under immense amount of strain.
How important was it for you, Emily? How important was it that you had that "it's not just me" moment, that we can all go through struggles and think that part of the struggle is based on the fact that it's you and you can't cope, and it's just an issue that you're gonna have to deal with? Why is it important, do you think, that you had that, "Oh, it's not just me" moment?
Yeah, so important. And because I think we all find it very difficult to share our most vulnerable moments. And doctors and healthcare workers are humans the same as anyone else. And while there's a lot of training to cope with very difficult things in healthcare, you're dealing with life and death literally, and a lot of illness, and you do learn skills to be able to mask how you're feeling. Many people go into that world to be someone that can be relied upon, to be the fixer, to be the person that takes care of everyone else. So to share that you have any difficulty is really difficult in the first place. And then, therefore, if there's not other people sharing their situation, then you do feel very alone. And that just enhances how you feel. So it's incredibly important to know that you're very normal and very human for having any kind of any kind of illness for a start, but in particular mental health illness that is just mental illness that's still very taboo.
In terms of, you mentioned sort of anxiety and depression when you were at medical school. Did you find that that just continued in? Were there added factors, or what were those added factors when you were sort of in the day-to-day job, in the 9 to 5? I know it's not a 9 to 5, but when you were in that sort of 9 to 5 environment, did it merely compound what you were already going through?
Yeah, obviously, my personal experience may be different from others, but I had had a bit of a history of anxiety and depression anyway. But to be honest, that was probably protective, because I was very self-aware, and I'd gained therapy and treatment in medical school, so I was very self-aware of what I needed. What I found when I worked as a doctor was it was a combination of everything. So it was this tendency for anxiety, which I was aware of, but combined with the very long hours, the high stress of what you're seeing from day to day and what people are going through, and then the unpredictability. So you can expect a long day, but you can never quite predict when you're going to finish your shift, and maybe you have to stay longer. And then all compounded to then difficulty sleeping, difficulty eating right. It all has this huge effect. Shift work, there's lots of evidence to say that people working in shift patterns have a big negative effect on their health. So it's a combination of so many different things.
I think people understand that people have sort of busy jobs. But the word I always associate with this is when something becomes relentless, that actually, that we've all had to stay behind a couple of extra hours or go in early. And like, that's kind of like the norm. But there is an element, isn't there, whereby if something actually becomes relentless and you actually think this isn't just a one off, this is ongoing, and I can't actually see a point at which this is gonna stop.
Mm.
People will talk about the experience of health workers during the pandemic as an example of this. But there is something in that idea, when something becomes relentless, your body and your mind almost loses the ability, doesn't it, to think, well, it's okay because in a couple of weeks' time I'm going on holiday. I could just relax. So it almost becomes consuming because of just you don't have that time to reflect, to put things into a compartment, to settle things down in your own mind and kind of get yourself ready to go again because you're already going again.
Mm, mm. Yeah, and there's a number of factors involved in that level of stress, I think. Firstly, it's where we enter the world of burnout, where you're stressed for such a long period of time without the adequate resources to recuperate. And you go into this state of burnout where a couple of weeks holiday isn't going to help, because actually this becomes a big mental illness where you are really struggling to cope with the workload and just day-to-day life, and it's a combination of many different factors. So 41.7% of staff felt unwell as a result of workplace stress. 33% of doctors are reporting struggling with their workload. 21% of doctors are at high risk of burnout. That was in 2023. So there are these huge rates of burnout across the NHS. So this is not just, yeah, I need a holiday, I need a break. It's, really entrenched, deep exhaustion and difficulty doing your job and functioning on the day-to-day basis. I also think another really important thing to mention is something called moral injury, which is becoming more known about in the NHS, where many people work in healthcare because they want to help people, they want to heal people, they love working with people. And moral injury is something where your values about why you're doing something have been disregarded, or you've got a massive clash in those values. So working in an under-resourced system means you can't do your job to the ability that you want to do it. So as you said quite rightly, Mick, it's more than just busyness and doing lots. You never get that satisfaction of doing the job that you want to do because you're trying to do it with not enough resources, and it's this never-ending list of wait lists and patients to be seen, and never a sense of doing a really good job.
That's really interesting. I've never heard that phrase before. Moral injury.
Mm.
That's
Mm.
really interesting. Um, it speaks, doesn't it, of the fact that the position as well to with which doctors are held within society, that if you can get past the receptionist, that you will you can have that conversation with them and they'll fix it. And if there's a problem, it'll get fixed by a doctor. And of course, the doctor goes, "Yeah, absolutely. That's why I spent however many years in medical school, so I can be in that position." The point at which you suddenly go, "Actually, I can't fix it," or "I'd like to fix it, but I can't." It almost that must have a huge impact on your sense of mission, if you like, if that's the right phrase.
Absolutely, and that was, I think, one of the, again, it was a multitude of things, but one of the, I didn't know the word back then, but when I left medicine, I think that was one of the really key things that was affecting me, is that it wasn't what I imagined it would be to be a doctor. I constantly got so frustrated with the system not allowing me to do what I wanted to do, because I was a first year doctor looking after 30 patients on a ward by myself in many days, because of lack of staffing, and it was quite honestly terrifying. Now, as someone prone to anxiety, there was kind of a personal element to that, but also I couldn't do everything that I wanted to do because of lack of time, lack of resources, lack of people. So it was an everyday occurrence that I would feel like I wasn't doing a good enough job. And actually, I blamed myself at the time, and now I know that it wasn't all my fault.
No, absolutely. I think it's really interesting. As you've become sort of an ambassador for now for doctors in distress, the conversations that you have with people who are still working within the health sector, what are they like? Do you hear, is it the same themes that are emerging, or are there different elements that you find that people talk to you about in terms of their experiences?
Yeah, very similar themes. And as you mentioned earlier, Mick, it's the more people talking about it now, it's coming out that actually so many people are feeling burnt out. Burnout is a huge theme, but people are recognizing now that we have a word for it, that it's not just exhaustion and stress, it's beyond that. It's a real concern. And thankfully, there are resources around now where healthcare workers, like doctors in distress, can come and seek help for that. Other things that I hear about a lot, again, are in the workplace in the NHS. The system has changed quite a lot over the years, especially for doctors, where there's a lot of moving around in different departments of a hospital, for example. There's less of a sense of a community that doctors can gather with, and other healthcare workers experience very similar things as well, I understand. But there's, as I think is very common in many other industries, where we have developed more online resources and social interaction, which is great. There's perhaps a limited place for people to come and feel safe and heard and not alone, especially if you're a healthcare worker and your days are just busy flying from place to place. So there's very much a location and community aspect, as well as the burnout and the stress of working in the system.
And in terms of that, when we start asking, well, what are the solutions to it? There's obviously a new government in place now that are trying to do things in the way that they see right. But at the same time, nobody can magic extra hours in the day, or even lunch hours are a privilege for some now. Um, so where do we what are those steps that could be put? Are there short term solutions that could be put in place that means that staff members just get maybe that breathing space, that sense of respite that just takes them out of that relentless sort of slog, if you like. When if it's about extra staffing levels and more money, that takes on time for on board, and then the people who are then stressed out end up having to train those new people anyway. So it becomes kind of like a stressful thing in and of itself. Are there easy solutions around this? Are there opportunities for staff members? Are there places that they can turn today or tomorrow within a short space of time that can really make a difference, do you think?
Absolutely. So firstly, talking about it more like your podcast and this situation, and really raising awareness of the level of mental ill health and burnout is the first step. That Doctors in Distress is primarily raising awareness of all of these things that are happening, so that it doesn't become such a taboo. And as we said before, so that people are more open about talking about what's going on for them, and they know that they're not alone. So that is the first step that is already happening and can happen straight away. So the most important thing, if for people to know, is firstly, you are not alone. And secondly, there is help out there. Thankfully, in the last few years, there's been various different organisations that have come together and started providing support for healthcare workers, and we still need to get that information out there. And the second thing I think is really important is um, having somewhere that someone can go to. So knowing these resources, but having somewhere that it's not even anything really complicated, but it's a safe, confidential space that someone can go and know that they are welcome. And this is what Doctors in Distress offer. They offer weekly support groups for all healthcare workers, completely free, that you can go online, so you don't have to get anywhere. You can attend this confidential supportive group to talk about anything that you're experiencing, and it's completely non-judgmental. It's facilitated by a professional, and it's somewhere that someone can go and they know that that's a safe space. And looking for more of these opportunities as well. I think it needn't be anything complicated. It can just start right now. You have someone to talk to, and that is half the battle, is talking about what you're going through.
Yeah, and that realization that you're not on your own. There's a stat related to sort of this the whole world. 87% of NHS staff are not confident their department will cope
Mm.
over the Christmas period and the winter period. Um, how much of that do you think, Emily, potentially is actually 87% of staff are not confident that they'll cope during that winter period? There's almost that sense of, oh, here we go again. The extra and added pressures that come in winter. There's the practicalities that these guys are struggling with, but at the same time, there's the mental health struggle
Mm.
that runs alongside that, parallel, if you like.
Yeah, really interesting question. I actually think that healthcare workers think in a different way. I don't think it would be about them. Yes, they would be worried, but the majority of healthcare workers throw everything into their work. They approach winter and they know it's going to be tough, and they push their limits. They work too much. And this is where the issue has come, because as you say, doctors are expected to be magic, and healthcare workers magic, and resilient and amazing. And yes, what an amazing role it is to be a healthcare worker. It is a huge privilege looking after people. But quite often this is to the detriment of healthcare workers' own health and well-being, because they go, right, things are going to be tough, right, dial down, I'm going to crack on, I'm going to armor myself up, and I'm going to get through this. So actually, I think healthcare workers won't be thinking about themselves individually, and this is kind of half the problem, as we want them to, because um, obviously we need people to continue working and not burn themselves out. I think the other really important thing to remember is members of the public, anyone not working in healthcare, need to continuously be reminded of the pressures that healthcare workers are facing. So there won't be a perfect day in the NHS. There's too much to deal with, and every healthcare worker that turns up for work every day is trying their best and doing everything they possibly can. But it's really important that all the service users, all of us going into hospitals, GPs, just have some patience and some understanding of the hugely difficult situation that they are working in every day.
I did a project during lockdown, and it was called Behind the Mask, and it was based on the idea that you were wearing a mask. We were all wearing masks, but healthcare workers were wearing it, and they were kind of it was this idea that they were somehow immune from all this thing. But I heard from doctors and surgeons, anesthetists, and all kind of different people who told me a story about what it was like to go home at the end of the day. You know, talking about things like getting changed outside, taking their clothes off outside so they didn't bring anything into the house, having a shower, in the garage, before you could even, like, give the kids a kiss and a cuddle after you get
Yeah.
home from work. Really brought home to me that it sounds silly, but you guys are just human beings. But of course you're
Right.
human beings. Yeah,
Yeah.
yeah, and but it was that sense that, oh, yeah, they just wanna go home and watch TV, and sit da there's a normality to it and a mundanity to it, which we don't necessarily think about because we think of the doctors, and they're gonna save our lives, and they're gonna and humanizing people, I think, on most levels is a pretty good way of seeing through some of the sort of like the bluster that you might get around a position, or maybe some of the misconceptions that you get around a position. Just to think, actually, these are human beings.
Yeah, and of course that can be scary when you are sick or a member of your family is ill and you're in a really vulnerable position. I think it's very normal to want a superhero or a magic person to be there. It's scary to think, oh, this is a human being as well. But of course, it's a very highly skilled, intelligent human being. But it is, so it can be scary to think beyond the situation and to kind of imagine that this person, is human as well. But it is, of course, so important. And actually, healthcare is about working together. And whilst you might be in a very bad place and be very poorly, there's if we are either visiting friends or family, or we are kind of less unwell, it's really important to bear in mind that this person also has a family, also has illnesses to deal with. During COVID, many people weren't even going home to their families. Many people were staying in Airbnbs, hotels on their own for that time. And again, that shows the sacrifice that healthcare workers will make, and yet it's often not seen.
Yeah, no, absolutely. And that person who's sitting down at the end of your hospital bed is also missing their child's nativity play
Mm.
because they've
Mhm.
got long shifts and they can't take their, kids to football practice, and they miss their anniversary meal because, they had to work an extra shift as well. So there's a real
Mm.
human state, a human sort of element to that, which we can think about. Can I ask you just, Emily, in terms of when you sort of think back to your time in those wards now, are there sort of trauma might be the right words, but are there sort of moments where you think back and think, "Goodness me, like,
Mm.
what was I doing there?" Or that was completely unsustainable? Were there days or decisions that you had to make where you look back and you think, "That absolutely typifies why that environment was not the right environment to be in at that particular moment?"
Mm. Sadly, many times, in my small amount of time that I was a doctor, I have many moments that stick out in my head of, feeling completely quite helpless and frightened, to be honest. I remember calling my parents and saying, "You'll be really proud of me," because some of the days that I got through, I just remember thinking, gosh, there's like any stressful situation, you rise to the challenge. And again, healthcare workers are incredible with what they witness. But there were many moments for me that mostly involved feeling very unsupported as a very junior doctor. I was in my first year and feeling like there wasn't anyone I could call to help me because of understaffing. And I remember one moment working on an elderly care ward thinking, oh gosh, I would be incredibly worried if my grandmother was here right now, because this is just me looking after 30 people, doing my absolute best, but feeling like this is not sustainable, this is not good. And I was running on adrenaline a lot of the time, and I think this is where healthcare workers fall into difficulty with their own health and well-being. Is you can there's a certain buzz of working in a high pressure environment, which many people thrive on, but you can only thrive on that for a certain amount of time. So having that all the time and no chance to recuperate is not good for anyone's health. Um, yeah, so there are a few moments that stick out of being quite traumatic, and some of those moments are to be expected in medicine. Some of them are absolutely to be expected because you're going to see horrible things. So some of the more horrendous things that I saw with people's illness or dying were kind of the part that I expected in medicine, because you expect to be involved with that. What was difficult was then going through that and then getting on with your job later and actually not ever debriefing. Now, I know that there are more systems in place now in depending on the hospital that you work in, where there are debriefing meetings, and there are support groups around for this kind of thing. Thankfully, this is building, but we need much more of it. It needs to become the norm that healthcare workers have somewhere to immediately go to debrief on some horrific thing that they've just been dealing with, so that they can recover and continue to do their job.
And in terms of what you do now, Emily, within the sort of the well-being space, I'm imagining that there are some people who will say, "Oh, she used to work in a medical professional, and now she's," and some people will, I don't know, presume you've turned into a hippie or something like that. But obviously, those who are a little bit more educated will know that that sort of well-being world is such a crucial part of how our human lives tick along every day and how we cope every day. How useful is your own personal, I call it lived experience, how lived experience been in terms of how you can now empathize and sympathize with people when they talk about what they're going through? And how have you been able to use your experience, which it sounds to be, a traumatic thing, which can be, really, debilitating in some circumstances, but you're now using that to grow and to help other people sort of grow as well.
Yeah, great question. Thank you, Mick. It's really interesting. So when I left medicine back in 2009, I ran very far from it, to be perfectly honest. I thought I never want to be involved in the medical world again. I made a mistake. I want to start again. And I continued to work in the charity sector that was involved with healthcare as well. And I taught for a while. And so I kind of skirted around the industry. But yeah, I thought I never want to be involved in medicine again. And then in the last 5 years, I became a coach, and again thought, I don't really want to work with medics, but have been drawn back to working with many doctors and healthcare workers, because I have been through this journey of self-acceptance and self-compassion. So learning that actually, I was very much of the mindset of, be strong, be resilient, work hard, play hard, stiff upper lip and everything. And I think there's still a tendency to dive into that approach nowadays. I still find myself being quite harsh with myself when I find I can't do anything or I can't work fast enough. But I've learned so much in the last 15 years since I left medicine about the real value of giving yourself permission to be human, giving yourself permission to seek help and have self-compassion, and to prevent a lot of the things that are much more difficult to treat than to prevent. So I still find it really interesting talking to people that haven't ever gone down that route or learnt about well-being, because it's part of life. It's the reason why we're here on this planet, is to experience this full life. And if we're constantly waiting for things to go wrong and fixing them, then that's a really difficult way to approach things. Whereas if we can try and take care of ourselves before things go wrong, then that's obviously going to have a brilliant and amazing effect on our work and the rest of our lives.
Emily, what we'll do, we'll put links to Doctors in Distress in the podcast notes so people can find those connections there. But I think generally, even people in different sectors will hear this conversation and apply what you've said and the thoughts on to them, and maybe situations that they found themselves in as well. So I really appreciate your time today. Thank you so much for speaking to us, and wish you all the best.
Thank you. Can I just mention the campaign as well for the
absolutely.
So they have just launched an emergency fundraising campaign, because this winter is set to be one of the worst winters on record for the NHS. And so Doctors in Distress have just launched Every Minute of Every Day, which is an emergency fundraising campaign to raise £50,000 to fund the weekly support groups that I mentioned earlier, for an entire year. Now, these weekly support groups are a lifeline for healthcare workers. So all healthcare workers can access these. They're online and they're free. Those who attend, whether it's every week or just dropping in as they need, they say it's a safe space where they can just be without judgment or shame. And Doctors in Distress are finding that many healthcare workers just need, as we mentioned, need this space to talk about their struggles. And it's hugely important that we protect our healthcare workers this winter. The burnout rates are extremely high, and There are devastating statistics. So one nurse dies by suicide every week, one doctor dies by suicide every 3 weeks, and Doctors in Distress are working to get these numbers down to zero. It's really important that we look after our healthcare workers so that they can also take care of us. We need to look after them this winter. So please do head over to Just Giving or Doctors in Distress website and you can donate there.
I hope you've enjoyed this week's podcast. Thanks for checking out Mental Health Monday. My name is Mick Coyle. You can find me on Twitter at Mr. Mick Coyle. You can also find me, Mick Coyle, on Facebook as well. Don't forget, if you want to speak to somebody about your mental health, you can do so. The Samaritans, free to call on 116 123. You can find mental health services where you are. Just look for the Hub of Hope. Type in your postcode. It'll find those mental health services close to you. And for support in a crisis, you can text SHOUT to 85258. That's if you're experiencing a personal crisis, you're unable to cope and need support. Shout to 85258. That's a text line. Do get involved in those services. In an absolute emergency, always remember the number to call is 999. Thanks for downloading the podcast this week. We'll be back next week with more Mental Health Monday.